大家好，我是 Claudia，我在香港完成了我的放射科专科培训，现在是香港儿童医院放射科的副顾问医生。The topic on treatment-related complications in children with cancer was proposed to me by Kevin, our training supervisor at Hong Kong Children's Hospital. As we frequently encounter numerous oncology cases at our center, monitoring for their treatment-related complications is a common indication for imaging studies. We selected this topic due to the critical importance of identifying treatment-related complications promptly, as this can facilitate timely management and prevent severe progression and adverse outcomes. However, many radiologists may not be familiar with the specific presentations of these complications. The breadth of this topic poses a challenge. Therefore, we endeavor to be both comprehensive and focused, aiming not only to create a presentation, but also develop a diagnostic guide. I was honestly surprised when I found out my poster had been selected for RadioGraphics. It was an achievement I never thought possible. Knowing how high the standards were for RadioGraphics publications, I was determined to give it my very best efforts. Preparing the presentation turned out to be quite a lengthy process, as condensing such a broad topic into a single PowerPoint presentation required a clear and organized approach. Kevin, along with the editors from RadioGraphics, offered incredibly useful suggestions for structuring and refining the content, which made it both practical and educational. Turning the presentation into a manuscript for publication was a whole new challenge. It required distilling a large amount of information into something that was clear, engaging, and concise. To do this, we needed to fully understand the essence of our topic, while also considering what readers would find most useful and interesting. The literature search was the most challenging part, given the relatively limited number of publications on pediatric radiology as compared to adult radiology. However, it was an invaluable learning experience to review and analyze the work of others in the field. With Kevin's guidance, we were able to compile a sufficient amount of high-quality literature relevant to our topic. On the other hand, collecting images was much easier because of the extensive oncology patient database at our center. It was also incredibly rewarding to take time to review and reflect on the progress of patients that we care for. Overall, the process was challenging but also rewarding. I learned so much, not just about the subject itself, but also how to think from the reader's perspective and navigate the complexities of preparing a manuscript for publications. These are lessons that you can only learn through hands-on experience, and I'm truly grateful for the opportunity. 这是一段非常有启发性的旅程，也是我最自豪的出品之一。我相信它增强了我未来在学术追求上的信心。因此，我鼓励所有年轻的医生们也来挑战一下自己，因为这宝贵的经验可以带来深远的回报。